Good day everyone, no? Or magandang gabi if gabi nyo man to napanood. So, what is substance medication-induced depressive disorder? So, it is a type of depressive disorder or depression. It happens when ang isang tao ay gumagamit ng substance such as yung mga illegal drugs, alcohol, or even yung mga prescribed medications, no? If meron silang tinitake, which mayroong side effect sa kanila. So, kapag yung substance na yon or yung prescribed medication na yon change how a person feels and lead to depression, they fall under this diagnosis. Moving on sa causes, first is the withdrawal from a substance or medication. This might cause dahil if the individual suddenly stop, mahihirapan ang katawan niya to adjust. When it no longer has the drug, it has become dependent on. And ang pinaka maaapektuhan talaga sa part ng katawan natin, no, ay ang ating brain. Because the brain has to adjust to not having the substance or medication anymore. As the brain adjusts to the absence of the substance or medication, magsa-struggle ito to regain sa normal balance of neurotransmitters such as serotonin and dopamine. Next is depressants. So, ano nga ba itong depressants? Are substances that reduce arousal and stimulation which affect the central nervous system or CNS, slowing down the messages between brain and body. It affects concentration and coordination and slow down ability to respond to any unexpected situations. Moving on sa symptoms, it includes distress, feeling very upset or anxious, low energy and fatigue, feeling pagod every day and lacking of energy to do daily activities, low mood, irritability, and difficulty in concentrating, struggling to focus, or having a hard time thinking clearly. For determining the symptoms, peer histories and careful judgment ay very important. Whether the substance of abuse or ng prescribed medication is associated talaga under this substance medication-induced depressive disorder. Or whether the symptoms are better understood as constituting an independent depressive disorder. So, pasok na dito ang alcohol, benzodiazepines, and other sedative, hypnotic, or anxiolytic drugs. Next is stimulants. So, kung si depressant is nakakatulong to slow down messages between brain and body, opposite niya naman si stimulants. So, what is stimulant? So, stimulants are a class of drugs that speed up messages traveling between the brain and body. They can make a person feel more awake, alert, confident, or energetic. So, these stimulants includes withdrawal from amphetamine substances and cocaine. While here naman sa some medication, it includes steroids, antihypertensive medication such as clonidine, guanethidine, methyldopa, and reserpine L-dopa. So, here naman tayo sa history nito. So, sa DSM-5, accordingly, the term substance-induced mood disorder has been replaced with substance medication-induced mental disorders. It is no longer used. And itong diagnosis na to, no, is part na siya ng bigger category, which is substance medication-induced mental disorders, along with a chapter of substance-related addictive disorders, while substance medication-induced depressive disorder is a specific diagnosis, which is yung symptoms niya is like sa depression that occur directly, which is the result of substance abuse. So, dito sa substance medication-induced depressive disorder, it focuses specifically on depressive symptoms. So, here naman tayo sa treatment. Meron akong nilagay na dalawa. So, first ay ang stopping the exposure to the substance or the substances or the medication or medications, which can prevent further negative effects on mental health. But important din na mag-seek ng guidance about this. Next naman ay ang psychotherapy. Psychotherapy is one of the possible treatment if an individual is diagnosed on this substance medication-induced depressive disorder. Psychotherapy will provide a safe space to talk about their feelings and experiences ng isang taong diagnosed nito. Through this, na-expose ang isang individual na diagnosed nitong substance medication-induced depressive disorder on how the substance or the overuse of medication has affected them mentally, their well-being, and for them to learn healthier ways to cope with this. Through this, makaka-help para sa kanila na mas ma-understand nila and to develop strategies on how to manage it. Moving on sa diagnostic criteria, no, these are the guidelines or standards which help to determine if na-meet nung patient yung mga particular guidelines before siya i-diagnose dito sa substance medication-induced depressive disorder. So, dito sa first criteria, the criterion A, no, it describes a significant and ongoing change in person's mood. It mainly shows up as feeling very sad or having a big loss of interest sa mga bagay-bagay na they used to enjoy, such as yung mga habits nila or yung mga daily routines nila. Dapat, no, these feelings should always be present all of the time and noticeable sa kanilang behavior. This is due to the direct physiological effects of a substance. It's either a drug of abuse, a medication, or a toxin exposure. So here naman sa criterion B, it says here na dapat there must be a proof of medical history, physical examination, or laboratory findings of both 1 and 2. So, yung 1 and 2 na sinasabi ko dito is, wala ko siya nalagay sa PPT, but sasabihin ko na lang kung ano itong 1 and 2 na to under dito sa criterion B. So, yung number 1, the symptoms in criterion A develop during or soon after substance intoxication or withdrawal, or after exposure to or withdrawal from a medication. So, meaning, kung mayroong symptoms based in criterion A, started kapag ang isang tao ay gumagamit ng substance or going through withdrawal or pagtigil sa paggamit or after niya gumamit ng medication. While sa number 2 naman, the involved substance or medication is capable of producing the symptoms in criterion A. Same din siya as what I've said sa number 1. So, here naman sa criterion C, naka-indicate dito na the mood problem can't just be explained by a regular depressive disorder na hindi caused ng any substance or medication. To show this, there are few signs to look for if it is a independent depressive disorder. First, if the symptoms preceded the onset, the substance or medication, so ang mga symptoms ay na-observe before pa man ng time ng paggamit ng substance or ng medication. If the symptoms ay na-observe na siya, no? For example, 1 month na siyang na-observe. Almost 1 month nang nafe-feel ng patient yung mga symptoms na yon, no? After stopping using the substance due to severe intoxication or withdrawal from a medication, it might indicate na mayroong other issue. Another is if mayroong history or similar mood problems that were not caused of any substances or medication or non-substance medication-induced depressive disorder. In simple terms, no, if paano ma-figure out if it is really due to any substances or medications or something else. So, moving on naman sa criterion B, the disturbance cannot only happen kapag ang isang patient is experiencing a delirium, which is a state of confusion or severe mental disturbance. So, sa madaling salita, no, if yung mga symptoms is hindi lang siya dapat, no, na-observe when the individual is experiencing a delirium. Dapat yung mga symptoms is dapat yung mga symptoms are present all of the time, showing na they are separate from the delirium. Last criteria, no, which is the criterion E. Here sa criterion E, if the symptoms are serious enough na nagkakos na ng noticeable distress or difficulties in important areas of life, such as relationship with friends and family, which is under social, performance at work or school, occupational, or other key parts ng ating daily life. But take note na diagnosis should be made instead of just saying na the person or the individual is intoxicated or going through withdrawal if yung mga symptoms sa criterion A predominate. And also na dapat yung mga symptoms to be serious enough na they require a clinical attention. So let's discuss about other specified disorder. Itong other specified disorder is for individuals na mayroong symptoms of depression na nagkakos ng significant problems in their lives but they don't fully fit into sa kahit or into any specific depressive disorder categories. This label is used when a clinician wants to explain the symptoms na na-observe don't meet the criteria for existing disorders. This is done by recording other specified depressive disorder followed by the specific reason. Examples of presentations that can be specified using other specified designation include the following. First is recurrent brief depression, where a person feels depressed and meron siyang at least 4 other symptoms sa loob ng 2 to 13 days or at least once a month for a year. They never met yung criteria for any other depressive or bipolar disorder. Another is short duration depressive episode, where a person experiences a depressed mood and at least 4 other symptoms sa loob ng 4 days but not less than 2 weeks or 14 days. And also, this applies sa mga individuals or patients who have never met the criteria for other depressive disorders. So, number 3 is depressive disorder with insufficient symptoms. It is when a person has a depressed mood and at the same time, meron siyang at least isang symptom na nakikita or na-observe for at least 2 weeks, but doesn't meet the criteria for any depressive or bipolar disorder. Does not currently meet or residual criteria for any psychotic disorder. And hindi niya na-meet yung criteria for mixed anxiety and depressive disorder symptoms. And for the last, is major depressive disorder superimposed on schizophrenia or related disorders. So people na diagnosed with schizophrenia may also experience major depression. But take note na if someone na diagnosed ng schizophrenia has a major depressive episode as part of schizoaffective disorder, dapat they should not receive ng additional diagnosis of other specified depressive disorder. So, sa madaling salita, the depression linked to schizoaffective disorder is already accounted for within that diagnosis. Yung mga symptoms na na-experience at na-observe are considered part of the condition. So, I think that would be all sa other specified depressive disorder.